Hello, Mr. Jones. Thank you for coming in today. I first want to start by talking about the different types of high blood pressure, what hypertension means, and then what even causes high blood pressure. So according to Delusion's story, when someone says they have high blood pressure, it means that their blood pressure has been elevated for quite a while. The blood pressure would have to be greater than or equal to 130 millimeters of mercury systolic over 80 millimeters of mercury or higher for diastolic. So hypertension can be broken down into two forms, primary and secondary. So primary hypertension is also known as essential hypertension. This has a slower onset, and we still don't really understand what causes it. But when someone is diagnosed with high blood pressure, it means that their body is working hard to pump blood throughout their body. Because of the high blood pressure, their body has to work harder all the time, and this causes many changes throughout. For example, the arteries, so those are the blood vessels that pump blood away from your heart, get smaller over time. This causes the sympathetic nervous system to overreact, causing an increase in heart rate. So the higher heart rate causes the heart to have to pump harder to force blood through the smaller arteries. The nervous system also works hard to fight these effects, which in turn creates a vicious cycle. In addition, the kidney is also under stress now. The stress causes the kidneys to release a hormone that causes the arteries to narrow and causes the body to absorb water and sodium. Then, in addition, another hormone is also released, which contributes to more retention of sodium and water in the body. So with more salt and water, this creates more fluid in the blood. Another hormone should be released to help the blood vessels open back up and help the body get rid of the extra water and salt. But that hormone stops working, so the body continues to hold on to the extra fluid and continues to have constricted blood vessels. This cycle unfortunately continues if the high blood pressure is not treated through medication and lifestyle modifications. The body can only keep working under the stress for so long before it has a negative effect on the whole body. The other type of hypertension is called secondary hypertension. This often comes on suddenly. Often the person has a higher blood pressure than they would have if they had primary hypertension. Secondary hypertension is usually caused by a secondary disease or illness. It can be caused by kidney disease, an adrenal gland disorder, and your adrenal glands, it's a gland that sits on top of your kidneys that release hormones that can affect things like your metabolism, your blood pressure, and your immune system, as well as other factors. There's also other factors that can cause secondary hypertension, such as sleep apnea, certain heart defects, endocrine disorders like hypothyroidism, and certain medications like antihistamines, decongestants, steroids, and illegal drugs. The last type of hypertension we're going to talk about is called complicated hypertension, which is also known as malignant hypertension. This is considered an emergency and very serious. When someone's blood pressure is greater than or equal to 180 systolic, so that's the top number, and or the diastolic, which is the bottom number, is greater than or equal to 120 millimeters of mercury. In addition to this very high blood pressure reading, the patient is also experiencing symptoms and may have some organ damage. The symptoms may include symptoms that would be similar to a stroke. They could have pain in one chest and difficulty breathing, according to Abal and Jamal. So complicated hypertension or malignant hypertension happens when blood pressure becomes very high over a short amount of time. This is usually caused by vascular changes over time due to untreated and unmanaged blood pressure. The damage to the blood vessels cause the vessels to become stiff and smaller, which makes it hard to get blood to your organs, such as your heart and brain. But also the smaller vessels break up the red blood cells that are traveling through it. So both these factors make it hard for blood and oxygen to get to your organs. Without adequate oxygen and red blood cells, the organs struggle to continue working efficiently. So based on the data that you have told me earlier on in the appointment, I wanted to review a couple factors from your past history. Mr. Jones, I'm sorry to hear about the loss of both of your parents. It seems that they both had high blood pressure. Because your parents had high blood pressure, that makes you more at risk for developing it as well. In addition to being male and African American, also puts you at an increased risk. But there are also lifestyle factors that play a big role in the development and progression of high blood pressure. You mentioned that you drink beers every night. Drinking more than 2 beers a night can also raise your blood pressure. In addition, you mentioned you don't follow any special diets. So if you consume too much sodium, it can make your body retain more fluid, which can cause high blood pressure. I know you mentioned that you work very hard for your job, but you don't work out regularly. When we don't work out regularly, our heart is not as strong and has to work harder to pump the blood. This can cause your body to also not use insulin properly. In your chart, it shows that you have gained 20 pounds during the last year. Weight gain also plays a major role in inflammation, increases insulin resistance, and vascular changes within your body. All of these factors really start to add up and can make hypertension or high blood pressure worse. I'm really concerned with your blood pressure being untreated for so long and how it's starting to take a toll on your body. So as we previously talked about the changes high blood pressure can make on your blood vessels, according to the American Heart Association, over time the blood vessels become stiff and harden as well as get smaller. This effect makes it harder for your heart to pump blood out through your arteries. Because your heart has to pump so hard, it causes the heart to get thicker and larger. This increased size places additional strain on your heart, making it work harder to pump blood and oxygen throughout your body. These changes over time can lead to heart failure. You had mentioned you were experiencing shortness of breath with activity and when climbing the stairs. I'm worried that this may be the beginning stage of heart failure. The Mayo Foundation states when the heart doesn't pump blood as well as it should, this can cause blood and fluid to build up in the lungs, which can cause shortness of breath. Today, I would like to send you for some additional tests while you're here in the office. But before you go, I would like to talk about some changes that you can make today that will have a significant impact on your high blood pressure. As we discussed earlier, by modifying your diet, this can help by lowering fats, sodium, and sugar in your diet. This will not only help with the weight gain, but it will also help to lower your blood pressure. There's a healthy eating plan called DASH from the National Institute of Health. This helps to lower blood pressure by eating fruits, vegetables, whole grains, fish, beans, nuts, and limiting fats and sugars. So I would suggest by adopting this DASH diet plan, by starting with one change at a time so it doesn't feel too overwhelming. By incorporating healthy eating and reducing alcoholic beverages each night, I feel that it will help make a positive change in your blood pressure. In addition, I would like to start discussing starting you on some blood pressure medication to help bring down your elevated readings. Thank you so much for coming in today. Do you have any questions?